What we know at a baseline is probably about 90% of people that are diagnosed with colorectal cancer are over age 50. And when we look at the last 10 or 15 years, we're seeing improvements. We're seeing a decreased rate of colorectal cancer in those patients because of screening. Because 15 years ago, maybe 30 or 40% of people were getting colonoscopy, and now that number is up around the 50 to 60% range. So we're catching those polyps before they develop into cancers. As a result of that, or maybe not as a result of that, a higher percentage of cancers are now being diagnosed in people under the age of 50. So I don't know that colon cancer is becoming more common in 35 or 40-year-olds, but in the big picture, more of our patients percentage-wise are a little bit younger now because we're succeeding with colonoscopy. We probably are catching more people in their 30s and 40s because we're triggering more colonoscopies in 30s and 40s because we have a family history. You've got a mother and her sister had colon cancer and endometrial cancer, so now we're getting you to get colonoscopy when you're 35 or 40, whereas maybe 20 years ago that person would have waited until their 50s to get colonoscopy. So I think that's one part of it. Another part of it is we're seeing a decrease in people in their 60s and 70s getting colorectal cancer. We're not seeing that decrease necessarily in people in their 30s and 40s, but more of those people are getting colonoscopy. So in the big picture, there's a little tick up in the number of people in their 30s and 40s being diagnosed with colorectal cancer.